Hello and welcome. I'm your host, Neil Howard. Thank you so much for joining us for another segment of Health Professional Radio. In this segment, we'll be speaking with Dr. Shereen Lim. She's joining us here from Australia. She's a dentist, and she's going to talk about her book, Breathe, Sleep, Thrive. Discover how Airway Health can unlock your child's greater health, learning, and potential. Welcome to Health Professional Radio, Dr. Lim. Thank you for taking the time this morning.
Thank you for having me.
Tell us briefly a little bit about yourself. I, of course, did mention that you are an Australia-based dentist. And what sparked your interest in Airway Health?
Yep. I'm a general dentist with a special interest in breathing and helping children achieve better breathing and sleep. My interest was first sparked by my husband's snoring. It was driving me pretty crazy, so I decided I was going to learn more about dental sleep appliances, which are helpful to help reduce snoring and obstructive sleep apnea in adults. And what I started to appreciate was that snoring is not just a noise. It is actually a sign or a symptom that we're not getting good airflow during sleep, and it could be a symptom of obstructive sleep apnea, which is really going to impact our general health and our quality of sleep, and is linked to increased risk of virtually every chronic health disease. And so I wanted to know, how come we're making these dental devices in adults? How come we can't just grow the jaws properly in the first place? And so that really prompted my search as to how we can intervene early with orthodontic treatment, and how we can intervene in the earliest years of life to address the poor muscle functions that contribute to poor jaw development.
What other personal experiences, other than your husband snoring, obviously, what other experiences personally or research-wise did you find most useful when you were putting your book together?
As I became more interested in what we could do early for children, I started to become involved with early orthodontic treatment for children, helping them develop their jaws better. And so I really became very interested in these children that were developing their jaws. When their jaws aren't developing well, it's a limitation of airflow, because our jaws are the floor of the nose, the space for our tongue, the skeletal support for our collapsible airway. And so when the jaws are a little bit off track, then breathing is not going to be optimal, and this can affect a child's sleep. So one of the populations or other experiences that I've had is seeing a lot of children that aren't sleeping really well, and their parents are concerned with problems like failing attention and concentration, difficulties with emotional regulation, ADHD type symptoms, and really maybe learning difficulties as well. So it really made me want to address these problems very early, and how can we prevent that poor jaw development in the first place. So I'm really involved with things like promoting breastfeeding, looking for tongue ties, which is a restricted string underneath the tongue connecting to the floor of the mouth that restricts normal elevation of the tongue. And when that doesn't work well, it can impact breastfeeding, and it can lead to the perception of poor milk transfer or milk supply, as well as pain on breastfeeding, and a very common contributor to early cessation of breastfeeding. So in terms of the question that you asked about what other experiences I have, I'm really involved in looking after those very young children, the infants who are having oral dysfunctions, because the way that their muscles are not working is impacting the way that their jaws are developing. Form follows function. So we need to have good muscle function during suck, swallow, and breathing to promote good jaw development.
It's my understanding that this book took a few years to complete. I think maybe it was a work in progress for about 6 years or so. Do you think that the timing played a role in bringing this book to, I guess, its highest potential?
Yeah, for sure. Well, when I first started this book, people were starting to question, why would a dentist be involved in these issues? But now there's so much more awareness of this. In 2017, the American Dental Association, they actually released new guidelines that state that all dentists should be involved in being able to screen for breathing problems in children, and being able to promote optimal airway through optimal jaw development and promoting nasal breathing and optimal oral function. And so now there's a lot more research to support dentist involvement in these areas, and so it makes it very clear that we must play a role in the integrative management of these issues. A lot of people think when a child's not breathing well, the first port of call is going to be an ENT surgeon. But what we know is that children have ENT surgeries, right? They have adenoids removal, tonsils removal, and many of them will still have persistent mouth breathing or disturbed sleep. And so it is a multifactorial problem, as important as it is that we clear any obstructions inside the airway. We need to expand and advance the airway by developing the jaws well, because they really are the outer box for our airway.
You're very busy dentist. What was the process like, just organizing the information that you were getting into a book format? Was it a difficult process to put it in a way that would be easy for your readers to understand?
Yes, it was. It was pretty challenging, for sure, because, as a dentist, we're seeing people on a regular basis. Sometimes we're seeing them for 6 monthly cleaning appointments. It's pretty quick appointment, yet there are so many clues inside the mouth that we can see that warning signs that a person that might not be breathing or sleeping as best as they can. And it's really hard to convey this information in a short space of time within a dental appointment. So I really did want to connect a lot of dots. And starting from infancy, how the way that the muscles are working, how we feed children, whether it's breast or bottle, or whether we introduce dummies, or how they breathe through the mouth or through the nose, how this can affect them over the years as they grow older, how their jaw developments, how their child is going to behave and learn, and their learning potential, and then how this plays out if we don't treat it into adulthood, how we're going to develop these adult problems like snoring and obstructive sleep apnea. To recognize that they're not things that suddenly occur with weight gain or with age. They are having their developmental origins from infancy. And so, yes, to be able to connect the dots and from many different angles, it was quite a challenge, but I think it was a really big work in progress. I had some good help with a good book coach who was able to really help me make it very relatable for parents. And that's been the big feedback that I've got from everyone. It's actually really easy to read, yet it doesn't sacrifice the scientific thinking that or research that parents need to understand why we do what we do.
What, in your opinion, is the most important thing for readers to take away from your book? And then give us a website where we can learn more.
Yeah, the most important thing for listeners to understand is that as important as it is to have good sleep, we need to make sure that people are getting good quality sleep as well. And the way that we breathe, whether we breathe through our nose or our mouth, it is going to determine the way that we breathe. And just as important as it is to ensure that we have an ENT that looks inside the nose, we also need to have a look at the outer box. And the jaws are the floor of the nasal passages, as well as the palate being the floor of the nasal passages. And we need to make sure we pay pretty good attention to developing good palate for nasal breathing. And this has to occur very early on in life. In terms of the website, I'm pretty active on Facebook, so Dr. Shereen Lim is probably the place where people can find the most information, but also the website is drshereenlim.com.au.
Well, Doctor, I appreciate your time this morning. Thank you very much. Is there anything that you'd like to add for us?
I think, when it comes to breathing, nasal breathing is a key foundation for good health and good breathing. And we must not ignore the snore in children, because when we have snoring, it's linked to increased risk of learning and behavioral problems. And the future is prevention by promoting nasal breathing.
Well, thank you once again. I appreciate it. And I'm hoping that you will return and give us some more information someday.
Fantastic. Thank you.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Shereen Lim. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to our podcast on YouTube at youtube.com/Health Professional Radio.